Hello everyone, welcome back to my YouTube channel, or welcome to my YouTube channel if you're new. My name is Maria and we are talking about lichen sclerosus. Today's video topic is questions and answers. You asked me some interesting questions under the videos and I decided to dedicate a video to answering these questions that are most important for everyone who watches this channel. I just want to underscore that all your questions and all your comments are highly appreciated. All of them are important, but I found several repeating questions. That's why I'm making this video. A little disclaimer here, I'm not a doctor, I'm just a patient with genital lichen sclerosus, so I'm answering the questions basing on my own experience and the research I did. Let's go! First question was, is Tacrolimus and Clobetasol the same drug? No. Tacrolimus is an immune suppressant drug which can be taken in forms of pills or creams or ointments, and usually it suppresses immune system not only in case of lichen sclerosus or other skin autoimmune conditions, but after organ transplant. Basically, Tacrolimus helps the body stop rejecting its own cells or the cells of the organ that was just transplanted in it. Clobetasol, it's a hormone, corticosteroid, which has an anti-inflammatory effect. Somebody will say that corticosteroids actually suppress immune system as well. Well, maybe, but their mechanism of work is different from tacrolimus or pimecrolimus. People who can't take clobetasol or any other corticosteroids for some reason usually prefer tacrolimus or pimecrolimus. Second question was, is laser treatment an option for lichen sclerosus? There are two types of damage that lichen sclerosus can leave you with. It is skin thickening or skin thinning, which is a skin atrophy. There are different types of lasers. There are thermal lasers, there are CO2 lasers, usually with skin thickening, which manifests itself with thick white patches of build-up skin. The doctors use CO2 lasers. The most famous is Mona Lisa laser. Yes, actually CO2 lasers can rid you of these white patches, which I underscore are results of skin thickening. In these cases, phototherapy is similarly effective. Basically, what laser or phototherapy can provide you with? CO2 laser makes a micro trauma to your skin. After that, the patch will dissolve. And of course, you'll have to undergo several procedures. It won't stop lichen sclerosus from coming back, unfortunately, but it will help you to regain the aesthetic looks of your skin, whether it's in the genital area or in any other part of your body. Some studies claim that CO2 laser or phototherapy can stop lichen sclerosus for a while. And yes, I did have some comments from lichen sclerosus patients who underwent this type of therapy and who gained remission for several years. If you have a skin thickening, why not to give it a go? But if you have a skin atrophy, I wouldn't recommend you to undergo a traumatic procedure which will traumatize the upper level of your epidermis, which is already brittle. If you Google erbium YAG laser, you can see also some results in lichen sclerosus patients and decide for yourself if it's worth trying or not. Also, you can Google thermal lasers, which my doctor claimed to be effective in some lichen sclerosus cases as well. Next question, where do I get my information? I'm a lichen sclerosus patient and I was diagnosed with lichen sclerosus on my genital in 2019. I've been experiencing symptoms from 2018, so you can imagine that I went through an enormous quantity of doctors. I take my information from my personal experience, my talking to several doctors in several countries, my chats with patients with similar condition, forums of patients with lichen sclerosus, scientific articles, medical studies, and of course from every open source that I can find. I don't have any medical degree, so everything you hear and see on this channel should be rechecked. And I encourage you to do that before taking anything into account. Next question is, where do you find the Neauvia Rejuvenation Rose Gel? I can't find it in the stores or online. Guys, I apologize. I got my Rejuvenation gel from my doctor in the UK. So usually you can ask your healthcare provider or your cosmetologist for this gel because it is usually used by cosmetic gynecologists. But also I managed to find it online on Thea Aesthetics, Mori Skin and Number One Cosmetics. The best way to find it is to ask around your local cosmetic gynecologist. But in case if you want to find similar products, here are the most important ingredients of Neauvia Rose Gel. It's a 3D fractionated hyaluronic acid and growth factors that you can see on your screen. Next question is, can the discoloration that is caused by lichen sclerosus be reversed? Unfortunately, not in every case. But if discoloration was caused by hyperkeratosis or plaques, which are basically a skin buildup, then yes, you can reverse it with laser or phototherapy. Also, I personally found some cases of oral lichen planus with white discolored plaques, and the studies claimed that Tacrolimus reversed them in just a year of using. Also, in cases of hyperkeratosis, if it just started, clobetasol or other corticosteroids potentially can reverse the discoloration of the skin. And another one treatment option for the discoloration, especially for the early discoloration, is PRP, platelet-rich plasma therapy. Can a diet help with lichen sclerosus? I had a video about a lifestyle with lichen sclerosus, which you can see via the link down below in the description of this video. If you don't have any digestive conditions like liver problems or gallbladder problems or pancreatitis or whatever it is, you can try different diets because your body is an individual case and nobody can tell you for sure if the diet will help you. But I personally know lots of people who could manage their other autoimmune conditions with keto diet and other diets. Also, you might have heard that, for example, Hashimoto disease, which is a hypothyroidism, can be managed by non-gluten, non-sugar, non-lactose diet, which is scientifically proved. These types of diet can actually lower the count of antibodies which are being produced in case of this autoimmune disease. So try and find out and let me know in the comment down below this video if the diet worked for you and which diet it was. And last question is, can lichen sclerosus develop without any triggers? Yes, it can. Unfortunately, lichen sclerosus can be asymptomatic for the long time in your life. And some people say that some kind of trauma or stress or disease has triggered their lichen sclerosus. It can be true, but in some cases, lichen sclerosus was just being asymptomatic, and as the body ages, lichen sclerosus manifests itself. Is it possible that there were no triggers at all, but lichen sclerosus came into your life? Yes, unfortunately it is possible if lichen sclerosus has already been there for some time and you had no idea about it. In this case, I would recommend you to do an immunogram, which is the study of your immune system condition. If you're worried that you might have some autoimmune condition, you can do the antibodies test, the immunogram, and other tests that will provide you with information on your immune system condition at the moment. Also, there are some genetic tests that can show you if you have this gene which transferred lichen sclerosus to you from your ancestors. This is all for today. Thank you so much for watching. I hope you enjoyed this video and found out something new. Please subscribe and hit the bell button below to always get some new videos from me. If you know some interesting topic about lichen sclerosus and if you want to talk about it, you can also leave the comments under any of my videos and I will do my best to make a video about it. See you all in the next episode. Bye bye!